Hi everybody, it's Alrina from Fleet Physio and Wellness, and I thought I'd just share with you a short little program that I do for my back and one that I share for my patients. Since I've had back surgery about 10 years ago, I tend to be really conservative about warming up and cooling down after exercise. But this little program, doesn't matter what I've done in the gym, if I've been deadlifting, if I've been doing HIIT sessions, it brings me back to normal again. So I hope it'll help you. Starting off with a few stretches, really quite simple, and you don't need any equipment at all for any of the exercises. You can do them on the floor next to your bed or in bed if you so prefer. So the first one, just bring your knees to your chest, and you can hold that there for 30 seconds or so. If you feel you need a little bit of loosening up, you can just bring knees to the chest, and you really want to feel that stretch across the lower back. Now, something I tend to say is if you don't really feel a stretch, don't bother to stay there for too long. Move on to the next thing that you do feel a stretch at. So mobilize a little bit, stretch a little bit. Then you're going to drop one leg down to the floor, all the way down, and you can bring that leg across the body so that you're stretching out all the structures on the side of the body here as well. Keep that knee right into the chest, and again, stretching anything from 45 seconds for the muscle up to 90 seconds for the fascia. But again, if it's just a quick, easy loosening up for you in the morning, you might just want to hold it there until you feel the stretch release the front of this hip and the buttock on the other side. The next one you're going to do from there, drop your arm down to the floor in a sort of cops and robbers hands up position, bring that hand across the knee, and then bring that leg all the way over as far as you can without lifting this shoulder up. So you might find that you're over there, and you might find that you can come all the way down to the floor with your knee, as long as this is not lifting. If you want to have a bit of a deeper stretch, you can turn your head across as well and have a full spinal twist there. Again, you can hold that there for anything from 30, 45, 90 seconds, depending on how much time you have and what structures you want to stretch. So from there, you're just going to let that heel drop onto that knee, bring that knee right up, and then grab hold of that knee behind. So this is your figure four stretch, or as I prefer to call it, your pretzel stretch. Bring your arms right in, so you're getting those biceps activated. Keep your shoulders nice and square, hips nice and square, and bring that up right up as far as you can. If you want to get a bit of a calf stretch here, you can bring the toes to the nose as well, and just double up on the stretching there. Same time to be held here, and you'll feel a really deep stretch in the hip on the opposite side. So from there, you're back at where you started. You're going to drop that leg straight. Remember, you now got hold of this leg. Take that leg across and over so you have a stretch down the side of the body, and you bring this knee right up to your chest. Hold for as long as you need. Drop the arm down, hand on the outside of the knee. Twist around, and you'll often, I don't know if you heard that nice big clunk in the lower back sometimes, and just making sure this shoulder stays down, shoulders are nice and square, and you can often just shift yourself again, get a nicer position and get down. And don't be surprised, as you can see, this foot touches quite easily. On the other side I couldn't get there. Doesn't matter, your body will be different every single day. And then coming back into your figure four stretch, grabbing hold of this leg, either above or below the knee, doesn't really matter. Bring that to your chest, and if you want a deeper stretch here, you can use your elbow against your knee so that your knee isn't pushed up there but opened up there. So either using it that way, or I like to just use my elbow and push out and up there. There we go. So that is a very quick and easy basic little stretch to get all of those muscles around the pelvis sorted. So the next four exercises, they're different variations of them. I'll run through different variations for you so that you can choose which one suits you best. The first one is just to activate your deep abdominal muscles, and you're going to make sure that you're moving on your breath. So you breathe in to prepare, make sure you get a nice deep belly breath, ribs and everything involved, 360 degrees, and getting it all the way down to the pelvic floor. So deep breath in, and as you breathe out, you drop your legs down to the floor. As you breathe in, you bring them back up. Same thing as you go down, breathing out and breathing in. What you can do with your hands is just feel on your belly and feel if you can feel that belly contracting and getting a little bit tight. What you don't want is to be arching through the back when you're dropping, or lots of movement through the pelvis. The idea is that you have a movement where your legs are moving, but your pelvis is not. So it's all about that stability around the pelvis. So breathing out, bring those toes to the nose, breathing in as you bring the legs back up. If that feels super simple, you can go into something slightly more advanced where you're doing a little bit of a dead bug. So bringing the arms and legs up into a box formation, breathing in to prepare and breathing out as you drop the opposite arm and leg and all the way up. Breathe in at the top, breathe out as you move, breathe in at the top, breathe out as you move. Again, the key thing here is that your lower back does not leave the floor. Slightly more advanced option there is to bring your shoulder blades up off the floor, and again, same movement, keeping the lower back completely flat against the floor. And these don't have to be fast. The longer you're in that position, the harder it is. So that's your first one, and you can choose any one of those three options. Second exercise is more for the sort of corset muscle that sits around the waist and gives us our waist shape. On bodybuilders, you can often see them as nice big muscles that sit right here. And for this one, you're going to have one leg straight and one leg bent. So the straight leg is going to get pretty much everything. Toes to the nose, locked out knee, and the hip needs to stay on the floor. In order to make sure that that hip does stay on the floor, you can just tuck your fingertips underneath your love handle. You can feel if there's any movement in the pelvis. And the other hand can come across, sit on top of the hip, or even sit inside the hip. So you can feel if that muscle is activating. So you're going to breathe in as you come across and breathe out as you go out of that leg. What you don't want is to be lifting away there. So if you come in, breathe in and breathe out as you go out. Breathing in as you come in, breathing out as you go out. This leg is very active. Everything's pressing down on this side in order to make sure that you're activating the muscles around here. Breathing in as you come back. If this is really super easy for you and not a problem, you can take it out and then raise that leg up a few times and see how you find that. And come out. If you find that's too hard, but this is too easy, you can just float the foot out and in without extending the leg. So the basic principles here are how long is the lever and how small is the base. So here we have the big base, the foot is down, slightly smaller base, and the smaller base and the longer lever. There we go. And then you're just going to repeat that on the other side. Foot, knee, hip, compress that side, bring this leg across just enough to get that compression, breathing out, breathing in. And again, if you find one side very different to the other side, absolutely normal, and you'll find most people have back pain more on one side than the other, particularly because I find this muscle tends to be weaker on one side than the other. So as you can see on the one side, I could easily lift that. On this side, I can't do that. My hip comes up. So this shows a little bit of weakness on this side. So you're going to do 10 repetitions of both of those. The next one, very familiar Pilates exercise, lying on your side and getting into position for a clam. I slightly amend how I do the clam just to make it more, in my view, biomechanically correct. And you have the feet slightly lifted so that your heel bones are pretty much in line with your bum bone. So it's not all the way up there, just a slight lift. Make sure that the hip is right down, stacked underneath the top hip, shoulders are stacked. You can have this hand in the front for support if you like, and just make sure that you're nicely balanced. Shoulders are stacked, hips are stacked, knees are stacked, feet are stacked. Then you're going to breathe in to prepare, and as you breathe out, you just raise that top leg, and you're watching out for a few things here. Don't fall back, so wherever that bottom hip was, wherever the weight distribution was, it should stay. And then as you come down, you breathe in. Now, what I quite like to look out for here is any weak spots in that movement. So if you're breathing in as you come in, you'll feel that's nice and strong and you might get a really good range there. And then as you breathe out, you'll feel the muscle just drops at some point. So what you can do there to strengthen that up is to come down, catch the weak spot, raise it just an inch, catch the next weak spot, raise it an inch, catch the next one, raise it an inch, and then all the way down. Exactly the same thing on the other side. 10 repetitions on both sides. And again, take your time with these because you want to find those really weak spots and catch them. When you're on your back again, now this is my go-to if I only have 5 minutes and my back's really sore and I'm having some issues through the day. This is my first go-to, and it's the one I tell my patients it's like 101. If you're really sore, you might find that just even tilting your pelvis is sore, but just start there. The minute you start giving your brain some movement through that area, the pain will start settling down, so just work through it. It's not damaging anything because it's hurting. You're just getting the movement and flow back into that pelvic area. So just tilting forward and back, and as you feel it gets more comfortable, you can arch all the way and just do little tilts. And then once that feels nice and comfortable, you can have your arms wherever they're most comfortable, but the bigger the area you take up with your arms, the more stable you'll be for this exercise. So if you want to make it harder, you can cross your arms across your body or lift them all the way up. So for now, just arms by your sides. And again, heels can be under your knees, so that makes it really easy, or they can be really far away, which makes it a little bit harder. So we go for middle ground here. Breathe in to prepare, and here you're going to contract the entire pelvic floor, so you're going to pull the pelvic floor all the way up to the belly button. So ladies, imagine you have 4 corners, the front, the back, and the 2 bum bones, pulling together like somebody picking up a handkerchief. For gentlemen, we use the analogy sort of nuts to guts, testicles to spectacles, whatever works best for you. Get those muscles activated, and once you've got them activated, then squeeze your bum. And on the bum squeeze is when you lift. And you don't have to lift super high, no arch through the back. It's more about control. So you're going to roll the pelvis up, roll, roll, roll. Keep your ribs down as long as you can until they peel away from the floor. Breathe in at the top. And you've got 2 options here. You can breathe out as you go down. Again, catching any weak spots. If you have weakness, tilt and tilt and tilt. But you want to drop the ribs down first so that the sacrum hits the floor last. Make sure when you take your in-breath here that you release the pelvic floor. So you're not holding the pelvic floor all the way at the bottom as well. So breathing in to prepare, breathing out as you go up, and breathing in as you come down and slowly release. Breathing out as you lift, squeeze the buttock, and then you go and check. You might think you're squeezing, there's nothing going on. So go and check. And coming down. Now what you might find quite interesting is that your pelvis comes up like this. So imagine a glass of beer or a nice lovely glass of wine on your tummy, and make sure that you're not spilling a drop. Pelvis stays the same. So you can have your hands on your hips for this if you want to make sure that they're evenly lifting. There you go. And then you can make this a little bit harder. So I'm going to bring my feet a little bit closer for this, just to make it that little bit easier. And you're going to lift up and then see if you can raise just your heel on one side and then the other without the pelvis spilling wine and beer all over the show. Or can you just lift your foot just an inch off the floor? Can you do that without the pelvis moving too much? If that's super easy, you might find you want to straighten your leg. Again, principles of the base and the lever. Small base, long lever. Small base, short lever. Or just keeping the base stable. Want to make it harder. Cross the arms. Raise the leg. As you can see, I'm not quite there yet. Dropping down, ribs first, pelvis last. And that's really it. You can do a few more bits if you have the time and you're so inclined. What I quite like to do, very familiar to everybody I'm sure, is the cat and camel. but 2 different variations of that. So arms right underneath the shoulders, knees right underneath the hips, and just tucking your nose all the way down to your belly button as you breathe in. As you breathe out, and as you breathe in, arching all the way up. So make sure that your pelvis is leading this movement. So you're tucking the pelvis under, there's a wave that comes through your spine, and eventually your head gets forced down. Pushing the pelvis to the floor, and the wave pushes you all the way up. So that will mobilize the lower back. You can do as many of those repetitions as you like. I tend to do about 10. And you can wriggle around in that position. You might be at the top, and you want to wriggle around. That's absolutely fine. Then if you bring your hands closer to your legs, do exactly the same movement, but now you're mobilizing more the upper part of the spine. And I'm going to show you one more little exercise of how to do that in a moment. And then another great one for acute back pain, lying in cobra position, making sure bum's nice and soft, lower back's completely relaxed, and you can just lie in that position for 10 to 30 seconds, come back down, or if you're very mobile, see if you can come all the way up there. If you have pain in that position, shift your body over one way and see if you have less pain there, or the other way and see if you have less pain there. From there, widen up the knees and just come into child pose if the shoulders relaxed. And again, you're stretching out that lumbar fascia that you did earlier, but also stretching out through the shoulder blades. What I tend to do when I'm in this position is just activate the pelvic floor before I get up and tuck the toes under, getting into box pose, holding that position. And as you can see, whatever the curve is in my spine, I maintain, and I lift just my knees up off the floor. So there's no tucking through there, no extra arching. Wherever I was there, I am there. Knees lifted, and you can hold that for as long as you like. Work your way up to a minute. And then last but not least, my favorite tool I have in the practice, my thoracic roller. I particularly like this brand because they're soft. You can do this with a towel as well, to some degree, but these rollers are absolutely invaluable for massaging your whole body if you need to, but particularly for mobilizing the thoracic spine. So have it in your sort of bra strap area, or if you're a bloke, where you would wear a heart rate monitor. Support your head, keep your tummy tucked in and nice and tight so that your lower back is as close to the floor as it'll get, and lean over backwards. And you can do 3 at each level, sort of at the bra strap area, 1 inch below, and 1 inch above. All the while making sure you keep the lower back tight and on the floor, or as close as you can get, and not just arching through like that. So that's the idea of specifically mobilizing just that upper area. Right, so that's my little program. I've been giving that to people for years. I've been doing it for years. It's usually effective, and you can take and leave whichever bits of it you like and don't like. I find I do them in that particular sequence because that's what works best for me, and it activates the muscles in a particular way. But you do you, and hopefully pop back in here and see what else I've got for you. Thanks for watching. Bye.